this all sounds good on paper, for Queensland especially. But who in our aged care communities is this targeted at?
The residential aged care is targeted at those people that can no longer be supported at home, with their supports coming from the community care programs, which provide a range of services to them. It will also target people with dementia that are finding it, either their carers are finding it challenging to continue caring for them at home, or the people with behaviours that are associated with that dementia that might require some kind of secure care.
Now, a federal election is around the corner, so it's not unusual to hear announcements like this, but was any of this a welcome surprise?
It was a very welcome surprise. It was very pleasantly accepted by Ozcare, as the people within the regions are fully aware of. Ozcare at the moment is just about to open. We've just started building our new facility in Mackay. A couple of years ago, we received 100 places in that funding round, but we're actually building a 120-bed facility. So the additional places allows us to offer all of those places as a funded place.
So this funding will go directly towards that infrastructure?
That's well, the supplying of those extra places as funded places.
Fantastic. Yes. And where will that free up funding elsewhere that was previously allocated to that task?
Those, when you have an unfunded place is what they would have been called, we would have utilised those places for a range of other optional services that we could have provided. So it was really around building capacity. We determined that we would build capacity into our new facilities for future growth and future expansion. And we would use those places in the interim for people that were coming in under other funded, Commonwealth-funded programs or state-funded programs.
I say, and now that that funding is secure, you can confirm those places will
be aged care places, definitely.
Is that a whole of what Ozcare applied for as part of this funding announcement?
Yes, we applied for some additional places in Mackay. Toowoomba, we're just about to open a new facility in April. We applied for additional places there. And nearly 18 months ago, we opened a new facility in Hervey Bay in which we built a number of extra rooms. So we've now got funding for those. And the advantage of that is that when the round gets announced, those places become operational ready very, very quickly. So we can start supplying services and providing services to people much, much faster than the initial round of allocation.
So what is your understanding of the timeline then for when those extra beds will be available from this funding at the Mackay facility?
So the Mackay facility, they'll be available from the moment we open our doors. You may be aware or not aware, we've actually already commenced the construction of our building up there. So at the moment the plan, all weather permitting, the building we're hoping to open by mid-2020, and they'll be operational ready from the moment we open our doors.
This is $960 million across the country. How does this compare to previous funding for aged care services, and especially here in Queensland?
I think Queensland's done exceptionally well this time in the round, but it also comes down to organisations making those strategic decisions to what they can provide, where they're already operating, where they might currently have facilities and have plans for extensions and expansions of those facilities. So it is a tender process that we all undergo, and that closed mid-last year, which we did all these applications for, and then it goes through quite a rigorous process around allocations. So I think when you look at the allocations for Queensland, yes, there's a number in the southeast corner, but there's a high percentage of places have been allocated to regional areas throughout the state. And what that does, it allows people to start and remain within the communities in which they've always lived. Ozcare, for example, we have quite an extensive community-based program and have been providing home care services and community nursing services and dementia advisory services for a number of years to the Mackay community. Providing residential aged care is just the next stage in that ageing process. So we can provide a continuum of care for people, but also within those facilities provide respite care to allow carers to have a break and to ensure that their loved ones are safe, well cared for at a time when they might need, a rest, a holiday, or just have some health concerns of their own and don't need to worry about those care and supports that they might normally provide.
You're hearing from Lanna Ramsay from Ozcare. She's their head of aged care on this announcement the federal government made yesterday, $960 million to expand residential aged care services across the country, including here in Queensland. What sort of questions and involvement will Ozcare have now to help determine where these new facilities are needed more and that funding, how it's used specifically at the Mackay facility?
The moment our design of our building, we have those places there. So at the moment we've got 36 dementia secure places in our plan. Whether we reallocate and rejig some of those allocations within the layout of the facility, it's early enough that we can do that.
And is that based on what you're hearing from the frontline services, whether there is higher demand in between now and mid-2020?
There's high demand, and if you look at statistical information, the population is ageing. We have a range of other chronic health conditions which are affecting people as they age and require different levels of support. And there are many people that can be cared for at home with support right up to the end of their lives, but then there is a high proportion of people that require that service where they've got easy access to 24-hour nursing care and supports.
Now, there's a lot of attention on aged care at the minute as the Royal Commission continues its investigation into the sector. How do you think that will influence the way funding such as this is distributed and monitored?
It's very hard to say. It's very early days of the Royal Commission and they're looking at and investigating, but also the aged care sector in general has been working through a number of reforms over the past 10 years and have got a clearly defined roadmap that we're working towards in conjunction with the Department of Health and along with a range of reference groups that the department consults with. So I think the agenda to improve access, streamline access has been very much on the agenda. I think the Royal Commission will hear the good, the bad and the ugly, as they say, but also too, the benefit of this is we've got to take the positive light and say hopefully this will make things better for the industry moving forward and better for the consumers of that industry.